Welcome to the Strive podcast, where we embark on a captivating journey through the realms of mind, medicine, and motivation. I'm Simon, your host, and today I'm thrilled to be joined by Scott Becker, a nationally recognized healthcare leader, attorney, entrepreneur, and founder of Becker's Healthcare, one of the most influential media companies in the industry. Scott is a partner at McGuire Woods LLP, where he led the firm's healthcare department for over a decade, and he holds both a JD from Harvard Law School and a CPA. What began as a small side project to share legal and industry insights evolved into a powerhouse platform that now connects thousands of healthcare leaders worldwide. Beyond his entrepreneurial success, Scott is the host of two top-ranked podcasts, Becker's Healthcare and Becker Private Equity and Business, and the author of The Entrepreneur's Edge, a playbook for building thriving teams and sustainable businesses. We explore Scott's remarkable dual career, the evolution of Becker's Healthcare, his insights on leadership and investing, and the mindset that sustained him across decades of growth and innovation. Don't forget to like, follow, and share this episode to keep up with all the insightful conversations we bring. For more updates and exclusive content, find us on Instagram or X at strive_podcast and on TikTok at SimonOfficial. Join our community and be part of the journey towards exploring mind, medicine, and motivation. Hi, Scott.
Si, thank you so much for having me. And now I've got to get to Twitter and other places and find strive_underscore podcast. I was just taking notes right now. So thank you so much for having me, and thrilled to get a chance to visit with you. Thank you very, very much.
Yes, definitely. And thank you so much for coming on the podcast. I'm really excited to talk about your very unique background and all the insights that you can offer our audiences along the way. Why don't we just start off talking about your dual career path, your early motivations and pivotal moments? What originally drew you to healthcare law, and how did that foundation influence the creation of Becker's Healthcare?
Sure. So it's a great question, and I love when people talk about origin stories, because I hear so many origin stories that I find to be so artificial and not real. For example, I hear somebody say, I started a revenue cycle company because my great aunt had cancer and she had bad bills. And I always find these origin stories to be so off and not real. So my origin story, I hope it's very real, very authentic. The reality is I didn't know what to do with myself in my late 20s coming out of law school. In your late 20s, you come out of law school, went to Harvard, go to a huge law firm, and it's a great learning experience, and it's brutal. You're working insane hours. It must be like being a med school resident at a large law firm. You're working crazy hours. You have no control of your life. You don't, but you're learning a lot. It's a great balance. And you're lucky to have the opportunity, but it's brutal. Some point in that area of time, I decided, well, if I was going to do this, I had to ultimately build a practice, which not too different than in medicine. It means you've got some business clients that come to you that are really view to you as you're their lawyer, you're their person, what have you. And I was trying to start building a practice and to build a practice so I had more control over my professional career. That led me by chance sort of into healthcare. It wasn't because I was trying to save the world. It wasn't because of like every family, I've got plenty of people that have been impacted with horrible diseases and stuff like that. But to say that was the driver of a healthcare career would be a completely, made up story. What drove me was I was trying to figure it out and build a career. At some point, I started picking up clients by chance in the healthcare world. And in building a practice, one of the beauties of being a specific kind of physician is you're really building a practice around that type of patient, that type of area, that type of issue. In law, if you're not careful, you're building a practice around everybody, which means you're building a practice around nobody. So at some point, a few years into this, I ended up really dedicating my entire time to building a practice in different sectors in healthcare, and thus started to grow into a healthcare lawyer. And it was a great time to do it. It was 35 years ago. The world was just evolving in terms of this intersection of healthcare and business and what was going on. And you're young, so you could learn so much so quickly. And the world was changing so quickly, as it seems to always be doing in healthcare. And it was a huge advantage to a young, thriving lawyer. So I ended up building my practice entirely on healthcare. As I started to build the practice around healthcare, I started to do some marketing things, a small newsletter, a small podcast. And the concept of those things, at that time, they didn't really have a name for those things. At this point, you would call those things thought leadership efforts. Those thought leadership efforts, the sort of newsletter, the small conference, and literally small newsletter was like a 4-page mimeograph newsletter 35 years ago, was a conference with 60 people at it. Now our conferences have thousands and thousands of people at them, but they were really small, starting points. And for the first 10 years of this, I was really focused on building the law practice, not building what became Becker's Healthcare, which started off with a small newsletter, small conference. And at some point, that small newsletter, that small conference started to build into something serious. And about 10 years into it, which goes back 22, 24 years ago, started to be like, I ought to take this seriously and try and build this into a real business, a real media platform. But one of the in some ways, I always straddled two different things, but in another way, there was always a first priority at different periods of time. So the first priority to begin with in my 30s was building the legal practice around healthcare. The second priority, probably my 40s, which goes back 20 years now, which is so embarrassing to say, was really building the healthcare media company, which became Becker's Healthcare. And there's always pivotal moments in these different types of things, and we could talk about some of these as we go further. But that's sort of the background origin story. It was really just an evolution. It wasn't like I joke about this origin story thing because I hear it so often from founders of companies that they make up an origin story and it sounds so, it just sounds so not realistic. But that's the reality of how this started getting going.
Definitely. And it feels like almost like a 360 in my own life because, growing up in undergrad through med school, I would read Becker's healthcare articles and stuff like that. And now I'm interviewing you, I'm very grateful for the opportunity to do so. I too have intersecting interests within healthcare, but also an aspect of business and trying to understand healthcare through a different perspective or have a different set of tools to apply it to healthcare. So it raises the question, like many people struggle to master one career, but you were able to not only take on law, but media simultaneously and excelling in both. What was your mindset for doing so?
Well, I think what happens is there's a couple different things. I'll come back to yourself in a couple things. One, we are so thankful that you were a reader when you were growing and going to med school, residency, and so forth. So thank you so much. The second is so many of the doctors that we work with over the years, physician leaders, physician entrepreneurs, physician scientists, are physicians first, but they also have some other itch that they are scratching. They're in business, they're in leadership, women and men. It might be that they're just leaders of a cheer of part of the system. It might be that they're doing a separate business, a million different things. But we find that it's a huge benefit for the long run, particularly if you can manage it bandwidth wise, not being burnt out. So the doctors I see that are the most burnt out are often like, I have a primary care doctor that I've known my whole life who's fantastic, but he's not just been a primary care doctor. He was early on in their technology integration, and that kept him interested. He was early on in leadership, and that kept him interested. In contrast, a primary care doctor that just sees 30 patients a day and doesn't have these other interests and these other pieces and outlets ends up being a burnt out physician almost always. I would say not always, but almost always. So that multiple interest is part of life. I think it's very hard to stay in one thing for 40 years and stay excited, stay motivated, stay at it. It's doable, but I don't know. For me, it's always been an evolving set of interest. One of the great fallacies is business people, experts, everybody does this a lot, is because you're good at one thing, you think you'll be good at another thing. And what I have found is, and I've had plenty of failures, what I have found is if you want to be great at the next thing, you have to almost, you know what got you to the first thing, but you can't believe what got you to be good at the first thing. It won't happen automatically. You better put in all that effort, all that energy, all that drive into the next thing if you want to be good at that next thing too. And so I'm obviously amazed at people like Elon Musk that do 10 different things. And he's obviously mastered the concept of being 24/7 and building great teams and stuff like that. But I think one of the great fallacies, if you're going to be good at two or three or four things over the course of your life, each one of them is going to take a ton of effort.
Definitely. And I think another point that you bring up is that, metrics for success in one area might not apply to a different area. And so you might have to have a completely different framework to approach these problems or, a different set of solutions for niche problems that might not be the same within like one industry versus another. And so looking back, when you were building Becker's Healthcare, and this is a different industry from the legal aspects of like your work professionally beforehand. How do you think you played between like the two areas or fields? Were you able to use your legal instincts or legal mindsets to foster your entrepreneurial instincts? Like how are they related and how are they different?
Yes, no. So I think there's a lot of commonalities in whatever you do, but you have to do them in each of the different things. So one commonality is if you're going to build a great legal practice or a great business, at some point you're building a great team of people. So you're thriving and building and growing a whole group of colleagues, now partners, now people that lead the firm that grew with me in building the practice. Nobody does anything like this concept you see on Twitter all the time of the solopreneur. I think there may be people that could do it, but I think it's largely a myth. I think most of us are doing great things if we're going to do great things with teams, not as solo people. So the one commonality is you're building teams. We start there. The second commonality is everything that I've done has been done in niches versus in the general business community. So, for example, I'll give you an example. We've had great success in the healthcare world, the healthcare media world. Our team has a great success in the healthcare private equity world. Is I've built a general business newsletter. It is fine. We get great. I enjoy it. I get great feedback on it, but it's very hard to compete with the Wall Street Journal, to compete with Bloomberg, to be sort of like, to win in that area. And so the commonalities that we think about are teams, we think about niches, we think about largely trying to provide a real community, a real value for a customer. Somebody really wants this. If somebody really wants this and they find usefulness in it. We just had our CEO meeting, and obviously the media business, the media world's a crowded space. So we have to work so hard to make sure that the different CEOs from health systems really find it a worthwhile use of their time to network, to visit, to learn from their peers, to sort of spend time doing it. But it's a constant making sure that whatever you're doing, the commonalities in everything we do are, I think, teams, niches, and you have to do something that's useful for a customer. And it's easier and harder in different areas. And then it takes it. I mean, I've never found a way around this. Some people are so gifted, they could just see it miles ahead of them and figure it out. For me, it's always been a mix of engaged and learning and evolving. It doesn't come like it takes tremendous work for me. It doesn't come easy for me. And it takes a lot of work to try and figure things out and really to keep on testing and experimenting, growing.
Definitely. And I also find that, being able to not just have like find a need, right? Like there's a problem that, we face across like many different realms of our lives. And we might have like, minor solutions that work in our own realm or respects. But then when you're trying to scale that or commercialize that, a good idea might not be commercializable or scalable, right? And so, you found this problem within or area of interest or problem of interest that you wanted to provide more information for through your media outlet. What was the thought process that went on when you were not just trying to figure out a solution, but figure out a scalable and commercializable solution to that problem?
Yeah, no, and everybody grows differently. And so for us, we had to do multiple different things. We had to constantly think about where were our limiting problems, where were our real challenges. So, for example, and particularly this is so easily evident today in the AI world, you could in the AI world produce 1,000 articles a day. And what happens is that once you get past a certain amount of articles, a certain amount of content, it is far more important that you've both got distribution and an audience and a community, just as an example. And I think as the world becomes more overwhelmed, connectivity, that community becomes everything. And constantly sort of like when you look at people, like people say to a wealth manager, like one of my friends is a money manager, oh, at some point you're going to be out of a job because everything gets done by AI. And it's really about the furthest thing from the truth because the market goes down 2% yesterday. Somebody freaks out. They still need to talk to somebody. They still need to figure it out. And what works optimally for finance may be very differently than what works psychologically for somebody for finance. So it's constantly finding these gaps in these situations, these positions. I mean, scaling is, again, it's trying to figure out the levels to scale in. So for example, media companies the size of ours often have 400, 500 people. We do not. We a long time ago decided we'd rather have this amount of people and figure out the right distribution channels than have like you see like these big media companies are constantly going through layoffs and non-layoffs. I think in the course of 35 years, we've laid off 3 or 4 people, literally, which I view as a huge win. But we didn't scale up and have a payroll of 500 people. We just never did that. We have 100 or 110 or whatever the number is on any given day, but it's very different than how some companies are built. And a lot of it is, particularly in today's world, we don't, I just saw yesterday Verizon's laying off 15,000 people. They're building a different kind of scaled business than we are. We're building niche businesses. We're really connecting with audiences. We could do it with 100 to 200 people, and it's a different game. So I don't know if I'm answering the question, but we've always built scale is, at some point we decided, as an example on scale, there are companies built around having 50 meetings a year with 20 people a piece at those meetings, and they're very successful. So they're a different kind of network and meeting. We decided we'd much rather have a meeting with 5,000 people and put all our resources into having that meeting that becomes a go-to place. And that requires a lot of choices. It requires audience development choices. It requires investing in big keynotes. It requires big agendas where the best doctors, best systems are wanting to come speak because it's an interesting place to be at, and it's good for them, it's good for us, it's good for their networking, it's good for them having peer-to-peer discussions. But there's a lot of choices on how you do things that drive how you choose to scale. I don't know if that's helpful or not, but we're a big fan of trying to constantly evolve and figure out what are the levers that work and what are sort of like they work, but they're not.
Definitely. And I wanted to go a little deeper into that about like the decisions that you've made, because I feel like the right decisions also have to be made at the right time. And looking at the trajectory of your company, what were some defining double down moments that you
Sure.
had to make, like decisions that you had to make that shaped the company's trajectory?
Yeah, no, there's a few that I always come back to and think about. There was early on, we were competing with a great publication. It was a print publication, and it's so funny because I don't know how old you are, but you're a lot younger than I am. So you're like, who the heck had print publications? But now I say that jokingly. But back in the day, there was a print publication, and you have to remember when I started this, we self-funded. So every dollar came out of my pocket, literally. And so the print publication was doing 60,000 issues a week and sending them out to 60,000 people every week. And if you are self-funding and didn't grow up rich, which I did not, my editorial team was like, we have to do that. And this goes back 25, 30 years. And I'm like, if we do that, we're literally broke in 2 weeks. Literally. Not a joke, not sort of metaphor. We're literally broke in 2 weeks. So we had to choose, and this was before the internet was everything, that we were going to be digital and event first, not print first. And it was at the time, it was sort of like, who knew? It ended up being the right choice, but not because we were so smart, but by necessity. So that was one choice. The other thing that we've always believed in is, I don't know if you're a sports fan or not, but if you're a sports fan, you go to the game, and they used to have what's called like the M race, and they still have some variation of this at every stadium, where during halftime or quarter time or a commercial, they've got M&Ms racing against each other, and one of them wins, one comes second, one comes third. In Milwaukee, the Brewer games, they have the bratwurst racing against each other. But essentially, you have to constantly recognize patterns in business. So, for example, we built out originally a surgery center vertical, then a health system orthopedic vertical, then a bunch of other verticals. But you have to be paying attention. Okay, we're putting a lot of effort into this vertical and nothing's happening. We're putting a lot of effort into this area and we're getting lots of customers, lots of attention, lots of people showing up, lots of people interested. And you have to be smart enough, and it doesn't take that much genius. It's easy in hindsight to say, like, well, we better double down on that M&M, that vertical that's winning, that's going great. You follow me? And so many people, like I see this, there's a whole book of, I forget the Strength Finder series of books and stuff like that, is from my business perspective, from my personal professional perspective, I'm a huge fan of if someone's great at A, B, and C, we want them spending 97% of their time on A, B, and C. I don't want them spending their time on D or E, which if they do their very best at it, they're going to be average at it. You follow me? I mean, personally, for example, I spend a ton of time golfing, but it would be stupid for me to think that if I put 24 hours a day into golf, I could become a great golfer. I'm going to be okay, but I'm never going to be great. Or if I spend 24 hours a day using the skills that I'm best at, I could be good at it. It's very similar in companies. If this is going well, we have to at some point accept that's only going to go so well over there. So we want to spend a ton of our time on this that's going great. Like one of our core concepts in companies, you'll tell me, Si, when you want me to shut up, is one of our core concepts in companies is you have to know who your customers are, who your best people are, where your money's coming from, where your revenues are, where your profits are. And the discipline is to spend 80% of your time constantly doubling down on that. And we've been with people, obviously we've all been with a ton of people that are always looking at the next idea. And I'm always a big believer that we start with, here's what's going great, and let's double down on that first. And you have to have your eyes open to make connections to see, like, this world is changing. We better work on this too. But at the end of the day, we're huge fans of constantly doubling down on what's working. And the biggest place that is, we talk a lot about teams and building teams. You have people that are great. Your whole job in business is to do everything you can to double down on those people. Comp, opportunities, situations, how they could thrive with you thriving. Let me stop for a second before I just keep on talking.
No, definitely. That was very informative, and that's what I was looking for. Just to go a little deeper into that, right? When it comes to, looking at companies across different realms as well, or I guess we'll call them firms. Like if you look at healthcare systems as a whole, right? They're lower margin enterprises that they're huge ships like that have to sail, and there's different considerations when it comes to that versus if you look at smaller private practices or stuff like that. And so when it comes to like advising or looking at the healthcare landscape with such a big system like that and like a little system or like little practice, where should you spend the most time differ between different instances like that?
Yeah, no, it's a great question. When we look at big systems, big systems that keep on doing well are often doing something right. So, for example, I not that long ago talked to the leader of a great system, I think $8 to $10 billion system, and the constant challenge as you become bigger and bigger is remembering, in addition to giving great care, we have to be great at certain things, like whatever it is. You have to be great at certain things, and it ultimately means stacking resources around certain areas, whatever those might be. Like you have to have a reason for being beyond just being a good community-wide health system. You have to be great at something in the ideal world. And it makes for hard choices because you go to some of the big academic medical centers, when you get past the Mayos and the clinics, and the Cleveland clinics, and a number of other systems, the benches in what are supposed to be their great areas are very shallow. I mean, they're just not very deep. And so what happens is, as a next level great academic medical center or system, you have to really figure out where we're going to be not just good, where we're going to be great. And that means we need 12 oncologists in that area, not 2, or whatever it might be, whatever the area is. And we see a lot of that. And in sort of small practices, again, like we talk a lot about, what are you trying to do? Are you trying to have a job, or are you trying to build a great business? What are you trying to do? And I'll just give an example. Like in downtown Chicago, there's a fantastic orthopedic practice. They've stated about 40, 50 full-time orthopedic surgeons. And they've got a lot of times the best and the brightest. There's another great practice in our area that's also fantastic too. There's a couple hundred physicians, or 150. I don't know what the numbers say. And it's very hard to be as great every single physician. You've got 200 of you, but they're very good. They're very, very good. But it's trying to figure out where you're going to be great. If you're a single physician running a practice, I think it's very hard to do today. But figuring out, what are you really trying to do? And what are you trying to create? And so I do think a lot of it is, there's always a couple things. There's always trying to be really good at whatever you do, and then understanding the commercial side of it too, which can be two different things, but they're both important if you want to keep on making it go and keep on making it work.
Definitely. And I guess I wanted to also follow up on that when we're talking about consolidation of different health systems or practices, right? Especially in the context of private equity or venture capital, it's consolidations versus like horizontally integrated health system consolidations, right? What do you think are the differences in how these practices are carried out? And I think I'm in a healthcare management class right now at school, and that's something we had a conversation about. That was actually my project presentation, and it's interesting because the benefits I think are very context dependent and very situation specific, but there are clear, I guess, negatives in terms of like market power or pricing power that kind of comes into the conversation. I don't really know what to think about it or like what the long
Yeah.
term consequences of are about it, because I can see the case for when you have much larger systems, much better coordinated care, right? Horizontally integrated and vertically integrated systems can improve efficiency and also enhance like the patient experience so that they're all within one system, don't have to travel like to 5 different places in the city or wherever it is, right? But I also see the negatives. So I just wanted to get your thoughts
Yeah.
on how the private equity venture capital backed practices are faring in like our current market, and also how the horizontal integration of like consolidated health systems are looking in the current sense.
Yeah, no, I think it's a great question, and the answer is it's all over the board. I mean, it's literally all over the board. It's a lot of it goes to, you know, why is somebody doing it? Why is a group doing it? Why is the health system doing it? Are they reasons that make sense for the long-term practice? Are there benefits to it? So, for example, give an example. People roll up certain types of practices, the relatively low margin. The whole concept is that you'll put them together, maybe they'll have more value together. But if they can't make money as small practices, you combine them into a larger practice and you add on a lot of debt, it's not a prescription for winning. So, for example, I always think the easiest thing to look at is low margin, high debt disaster. So you take a low margin specialty, you add debt onto it, it's likely to be troubled in the long run. And the reason we mention that is private equity, you do an acquisition, you're typically using debt to recapitalize it, to finance the acquisition. So you end up with practices that end up with debt on them. And with a very healthy practice, an orthopedic practice, a roll up in orthopedics, a roll up in practice with good margins, this could work very, very well and provide solutions and provide answers. In a practice with low margins, OB-GYN, some primary care, and others, this could just be a disaster because there's not really a real benefit to it in the long run. It's hard to see how it really does better. It worked for a period of time when people were getting paid well by Medicare Advantage, some other things, some of these practice areas that were low margin well. So all of a sudden they get a capitation, but they weren't delivering as much services. So for a while, there was a real sort of pop in it, but that pop is already gone now. On the health system side, again, it depends so much in all these things, the private equity driven practices, the health systems, so much of it depends on internally, do they have really good leadership that has clarity about what they're trying to do? So, for example, you could on paper roll up three health systems together, and if there's not a great leader behind it that can figure out how to really drive leadership, you're likely going to lose in the long run. If, in contrast, you've got a leader and that has a vision for what they're trying to do, Gene Woods is a pretty good example. He's the CEO of now Advocate, but was Atrium, and combined with Advocate in Aurora, North Carolina, Chicago, Milwaukee. They combine these three systems a lot in Atlanta too. Gene's a really gifted guy, and so he's sort of been able to steer that 30, 50, $40 billion system now towards moving in the right direction constantly and trying to. He understands that they combined with an academic medical center, Wake Forest at some point, because they understood they had to also constantly upscale a little bit what they were doing. It can't just be a giant okay health system. It's got to constantly be getting better. So there's examples where people are doing things that make a lot of sense. There's others where people combine and they're really a disaster. And it's very, very you said it before. It's very context specific. To me, it's often very leadership specific. There's been there's been great leadership at Hartford Healthcare in Connecticut. They've done an incredible job of growing into a serious system out of something that 20 years ago was not a serious system. In Chicago, we've got the Endeavor Health system that's grown into a really nice system that at one point was an assemblage of hospitals that weren't great hospitals going back 10, 20 years ago. And sometimes you have to be big enough. You don't have to be the biggest, and being the biggest is also hard too, but you have to be big enough to be able to, invest in the technology you need. I always say you have to be great in some areas. Being great in some areas costs money. And if you hire 20 great doctors in oncology, not all 20 of them are going to end up being with you for the long run. Or if you're trying to build a great orthopedic practice, it's the same thing. It takes a lot of money, and you have to have enough capital to take risk to be able to really build greatness around areas. And so I think there is a need for some scale. Different parties do it differently. And there's no perfect size system. It's very hard to be a small system today, but there's lots of systems that are 2 to 6 billion doing great work, and there's plenty of systems 5 to 15 billion that are doing great work, and there's plenty that are a disaster.
And on that note of leadership, you yourself have been a great leader within your fields. You've interviewed many leaders and thought experts across various industries. What patterns or traits did you notice in these great leaders across politics, sports, and business?
Yeah, I think it's a great question. It's not an easy question because so many leaders have different personalities. I think at the end of the day, like they have to be able to build teams of highly talented people. So like what happens is you get into organizations beyond a certain size. And I'll give you the perfect example that I always think of. I was on the boards of 2 different companies earlier on in my career. One company had one spectacular leader, but didn't have a deep bench of leadership. One company had 5 leaders. All of them were excellent. And this was at a time when these are smaller, mid-sized companies, but the company that had 5 to 7 great leaders, none of them might have been as great as this one great leader at the other place. But that company that had 5 to 7 great leaders ended up having a 40-year run that was and turned into a great company. The one that had one great leader, even though that person was extraordinary, it just burnt out. The company burnt out, ended up selling for a certain amount, nowhere near the value it could have had, because there's only so far you can go with one great leader versus building teams of leaders. So like when you look at a system today, the job of the leader is the most important job of the leader is to make sure that he or she has filled out the 10, 20, 30 spots side by side with him with great people. Like that's the most important thing a leader has to do, and set the vision and set the strategy. And there's some public facing nature of it, but really the number one thing a leader has to do is develop great colleagues, great teams, great leaders around them if you want to build a serious organization. It's sort of how we look at it. And people do that in all kinds of ways, but it's like people talk about the great business leaders of our times, whether they be people like Elon Musk or Mark Zuckerberg or Steve Jobs or whoever they are, Bill Gates, so many of them, Judy Faulkner at Epic, so many of them. But the great success of a leader, like I look at Steve Jobs, I look at Bill Gates, and the greatest compliment you could pay to Steve Jobs and Bill Gates is that their companies are greater after they were gone. After they were gone from leadership, at least. That's an amazing thing. It's an amazing thing that they both built an institution and they built a cadre of next generation leaders that could lead it once they were gone. That's like we always say about leaders, 3 ways to judge leaders: results when they're there, results when they're gone, and how many other leaders do they develop. So you have to have results when you're there, but if you're a great leader, you've also developed other great leaders, and the results when you're gone are better than when you were there. And that's not easy to do. That means you really understood it's not just you. Steve Jobs might have been the face of Apple. Elon Musk might be the face of everything. Bill Gates might have been the face of Microsoft. But the fact that Bill Gates and Microsoft's more successful now than it's ever been. I think it's the second or third largest market cap company. Apple's the number two. I mean, that's an amazing feat that these companies are excelling past the leader that drove them to begin with. I mean, that to me is the greatest compliment you could pay a leader. And most all these leaders understand they have to be smart, they have to make good decisions, they have to really appreciate their people, and they have to grow great teams.
So one individual does not make the system, but the sum of its components is what truly influence like change and lasting impact.
I think that's right. I mean, I look at Gene Woods at Advocate, the amount of people that want to work with Gene and be leaders of the different hospitals and health systems that he's a part of. And Gene they don't have it easy, Advocate. It's a $35 billion system. It's not like Cleveland Clinic and Mayo where it's only in getting the highest paying patients. You know, they have a hard job, but the fact that he's able to make that work because he's building a culture and he's building people that want to work with him is a real compliment to what he's doing.
And looking into healthcare industry trends and the future of how you see it evolving, I just wanted to start off like in your over 30 years experience within this field, how have you seen healthcare evolve and what changes have surprised you the most?
Yeah, that's a great question. You know, what happens to these changes is so many of them are like the frog in the boiling water, so to speak. They happen over time and then they happen. You know, so like what has surprised me the most is how for all the efforts made at this, well, I'll give you two things that surprised me the most. One is how broken DC is about healthcare, how broken that is. And that's on the left and the right. They're both just broken, and they spend so little time on the core problem of how do we fix access, how do we create more doctors and nurses, how do we make sure that we actually have the labor to go with the technology to take care of people. So I'm sort of, that's sort of the one thing I see is this, how broke that is. The second thing I see as we get shorter and shorter, and the fact that we only have about 1 million physicians for 345 million people is a self-inflicted wound of the system. You know, you're a physician, so you see this. There are so many areas in our nation, even at the most elite institutions, where the depth of help in specialties is so short. Not even to mention my primary care physician, again, I mentioned earlier, he's been a friend for 40 years, known him forever. But the reality is when I went to reschedule my primary care appointment, the next available appointment, this was June, was April of 2026. And of course, I was able, he's a close friend, so I was able to get in earlier. I'm doing it in November sometime. But the concept that the next available true primary care physician appointment was a year from now, a year from when I asked, is it's a symptom of how messed up our supply and demand is. And we've got to figure out a way to fix that and change that. And this goes into the issue of like when you have your I know that I'm 61 now. By the time you're 61, and everybody, the beauty of healthcare is all of us are consumers. Every single one of us are consumers. But by the time you're 61, you've seen so many people that have had cancer, that have had this, that have had that. Increasingly, you get to a certain age, whether in your 20s where you lose a friend to leukemia, 60s you lose a friend to cancer, or lots of friends to cancer, you start to realize how short the bench is of real solutions for really difficult situations. And not only how short the bench is, how short the solutions are for certain cancers, but how narrow the amount of doctors there are to really take care of something. And how bad the access is. So I'm surprised that we all know we were going to have shortages. We've often mismanaged resources for political reasons. I mean, there are so many things that are great about our system, and there's so many things that are so screwed up. I mean, we all thought, of course, most of us are believers, if you're in healthcare, that everybody should have coverage. That ideally, you know, we're basically believers that how many ever people we have in our country, everybody should have coverage of some sort. I mean, I think most of us feel that way. But the problem is coverage without supply and access is a political slogan. So we need to figure out a way. If you're going to want to have coverage for everybody, okay, I'm on board. But then we better focus on how do we create more doctors, nurses, technology to fix that. And what you have on the left is the belief we need coverage for everybody. I'm not particularly left, but I totally believe we need coverage for everybody. You have on the right, it should all be free market. We hate the Affordable Care Act. We got to get rid of that. And the reality is, the truth on both these things is somewhere in between, of course. You can't have coverage for everybody without creating more doctors and nurses. We have to address the problem. If you're on the right, you have to address the problem. I could agree with the right that just putting more subsidies through insurance companies has proven not to be a solution. It's made healthcare more expensive. It just doesn't work. It doesn't work. But neither party wants to address the problem. Like if I was czar, we would have a ton more residencies for specialists. We would continue to have residencies for primary care. We would obviously move towards a lot more PAs and NPs helping on the lower levels of primary care. Like there's ways seemingly to do this that get us closer to solutions. We of course would embrace technology, but it seems like we've become this Byzantine structured solution with dollars flowing all over the place, but to where they need to flow to, and nobody trying to solve problems. I mean, the right seems to be right now caught in this game of we hate Obamacare, we hate subsidies. God, there's a lot I agree with there, there's a lot I disagree with there. The left is we need the subsidies, but nobody knows where the money's going to for in reality. And we know we want coverage for everybody, but at the same time that we want coverage for everybody, we got to figure out supply and access, because coverage without access is just like it's like writing a check you can't cash, and that's where we're at. And so and what amazes me is that there's just no adults in the room, or very few on either side. Like you can't have somebody on the Democratic side be willing to say, we want this to work. We haven't figured out how it exactly works, but let's figure out how to make it work. And so, but you have on the left, just let's keep on throwing money at it on the coverage side, because this was something that was put in place by the premier president of the Democratic, the last generation. So we don't want to change it. And the Republican side, they're on the other side of this. They're not providing any solutions. They just want to tear it down because it was President Obama's effort. So you end up in a spot where there's no adults in the room on either side trying to say, how do we solve this problem? How do we figure out how to provide health care to 350 million people? We tried this game of we're going to turn it over to the insurance companies, and they're going to manage it, and that's going to control access, and that's going to control cost, and that's obviously just been a disaster as far as I could tell. That turning it over to the insurance company just been another tax on the system. It's not done anything to solve health care. So we got to figure out how are we going to do it? How do we actually make sure that 50 million people have health care and good health care? It's not easy. When people say like, well, look at Denmark, they've got great health care. I'm like, they have 12 million people. It's a lot easier. Or look at Maine, they've got perfect health care. They have 1 million people. We have the third largest population in the world after China and India. China and India have horrendous healthcare problems. People can pretend they don't, but they do as well. We saw it during COVID. China essentially had to lock up everybody they have because they couldn't afford to have a spread of disease. So have enough nurses and doctors. India went through a few summers where it was really hard because they just don't have enough people, enough labor and doctors and nurses. Here, we're the third largest company. Pretending that it's easy, that there's easy solutions is wrong. But because we are the third largest country in the world, but this concept that, in the old days, at least you'd have Democrats and Republicans having intelligent discussions of how do we actually solve this? How do we actually get there? We tried this Medicare Advantage thing. We tried to turn everything off over to the insurance companies. This just seems to be just an added tax and a disaster. But how do we actually solve it? What's the real problem? The real problem is, we see it. The beauty of healthcare, as I said earlier, is, and excuse me for just going on, is every single one of us is a consumer. So I can't tell you something that you're not seeing in some way too. We might have different experiences on it, but we're in a spot where when you ask me what surprises me, we already have a two-tier system. People on Medicaid, maybe some of the governmental versus the rest of us. And the rest of us is a mix because everybody's got some family members, either directly or pretty close, that are on some of the government programs. But what surprises me is when you get outside of Medicaid and the people that are truly poor in our country, you now are going to have multiple tiers outside of that. So if you would talk to me, what surprises me is in places like many states in our country, if you want a primary care doctor today, you have to pay for concierge care, which means you're going to have another set of tiers. And I don't blame the primary care doctor one bit, but it's a reflection of we're just short on all these things. But you're going to have, like, you've already got tiers, where the richest get to access the quickest wherever they want. The next richest can get concierge for everything they want. The next group is like, I hope my primary care doctor doesn't retire or die, so I don't know what I'm doing next. And the next group gets what's left over. And it surprises me that it got so bad so quickly. It's so obvious to so many of us. I mean, there's so many things that surprise me. Let me stop for a second and let you get in a question or something.
No, definitely. And I think you brought up many great points about, the intentions might be being right, but then the actual application or, seeing it playing out might not be in line with what the intention was. And with such a large population and such a diverse range of demographics that we have in the US, it makes it even more difficult. And this is like a, thought or view that I've been tackling with too, because I think mandating health insurance, like I understand like the intent behind it, but then adding all these extra components of Medicare Advantage, with the Medicare population going more, choosing to go towards like the Medicare Advantage route to have lower premiums, lower health insurance, but then, you subsidize it to private firms, right? And then so you might think that you're getting cheaper insurance, but then, you have these prior authorizations or in-network, out-of-network coverages or, hidden things like that where you say you're covering, healthcare for everybody, but then when it actually comes down to it, like, seeing the patient get care, it might not actually translate like that in practice, which I guess is frustrating because again, the intent might be right, but in practice, it doesn't really work out. It's a lot of complexity built into the system. And another thing I'm concerned about as, these trends go the way they are, especially like, policy wise, is I think there's decreasing autonomy for physicians that's talked about as well, which I'm not sure how it's going to play out in the future. But if physicians are not able to take proper care of their patients because some insurance company is denying their prior auth, or, the patient can't even get to the physician to be able to take care of them, I find it very difficult to see how that system would last or endure.
Well, no, it becomes like anything else. The most important thing you have to do in any business you run is make it easy for your people to do their jobs. And so if you every time you add more tension to somebody's job or more friction to their job, they start figuring out what else they could do, how else they could do it, and so forth. So it's another thing that leads to tremendous job dissatisfaction and burnout, and of course has the impact of a negative impact on care for sure. 100%.
And in terms of just looking at the current trends right now, like workforce shortages or payer consolidation or ASC evolution, where do you think innovation in those different trends will shape the next decade of healthcare?
Yeah, no, it's a great question. I think at some point we're going to get, hopefully, I shouldn't say hopefully, but we're going to get slammed into some bipartisan working on solutions, because unfortunately, you could say, well, it shouldn't have to be a government solution. But unfortunately, 40% of healthcare today is paid by the government, by Medicare and Medicaid, and residency restraints and our challenges, shortages of residencies are driven a lot by budgeting for them or not. So I think one way or another, you're going to have sort of a bipartisan effort. And I don't think it's going to happen until you have people. So you're getting close again. You're right. What you're hearing right now is people are so irritated on the right and the left, poor or wealthy, about their healthcare cost. I mean, the insurance cost, and it's very complicated politically, because if you're a person who has health insurance and you're paying literally 30,000, 40,000 a year for it, you believe the system has become broken, and so there's not a lot of empathy, or as much empathy as there should be, for the ACA subsidies and everything else. So you have two things that could cause us to get to solutions. One is that people get so irritated with the cost that we got to figure out a way to solve it. The second is that you actually have some bipartisan work in DC focusing on the real problem. Because like the real problem right now, on both sides, a couple years ago you saw these campaign signs on the right saying get the government out of my Medicare. And that's obviously a ludicrous political slogan because the government Medicare is a government program. I mean, it would have been better to say get the private companies out of my Medicare, but a different question, a different issue. On the left, you have people just yelling about subsidies and coverage for everybody, and it's so popular as a slogan, and I get it, but it misses the point of how do we actually, like, I thought we would get to the spot where the Affordable Care Act would lead to greater coverage, and then we'd be able to work on solving the next problem, which is how do we actually get care for everybody and access for everybody. What's happened is, and this I think is bipartisan screw up, on the left, got coverage down to 8 to 10% people uninsured, which is close to where you can get it to because there's 3 to 4% of people that are just all over the place that are not really almost identifiable, and you're never going to have coverage for. It's like the job market. You're never going to have a job for every single person because people float in and out of society for better or for worse. But you got down to 8 to 10%, which is pretty good. But nobody then said, okay, how do we now make sure this 92% or 95% or 100% of us actually have enough doctors, nurses, supply to take care of people? And many people looked for easy answers. Oh, we'll turn it over to the insurance companies to manage, but that was just a disaster. I mean, it's just been a disaster in my mind. And I think most people recognize it because they hate the insurance companies on the left and the right equally. And it's the first time you're having a pullback from Medicare Advantage now because it's just not going really well. And then I just think that you have to at some point deal with supply and demand issues. I mean, it's very basic. I mean, we need 10,000 more residency spots. We need more doctors. We need to figure out how. I mean, we're in a spot. Obviously, we're most of us in our country. I might be third generation, but most of us in our country are immigrants one way or another. We're not all from here. With the beauty we had 20 years ago, 30 years ago, 40 years ago is doctors would come in either out of the military or from other countries, and they'd go to every small community in America, and there'd be health care throughout the entire country. Now we're at a spot where people are more sophisticated, the husbands and wives, whether the doctor's the wife, the doctor's the husband, they're only going to the top 20 metro areas, or pick a number. So you've got these horrible shortages in many, many small areas. We've got a horrible lack of depth in more complex diseases. It's horrendous. We're never going to solve the primary care problem, so we better figure out other ways because there's not. They say we're 200,000. You could look at whatever stats you want. We're 200,000 short primary care. We only create 10 to 12,000 primary care doctors a year. We create 25,000 doctors a year. 10, 12,000 doctors a year retire. So at the current trajectory, it's just a disaster and getting worse. So how do you sort of manage through those things to where we start to solve these problems and understand we're never creating enough primary care doctors, so we better figure out how PAs, nurses, NPs with a lot of AI and a lot of help and a lot of oversight and really smart PAs and NPs can do a lot of what primary care did. And then we better figure out a way to double down on specialists, particularly in complex things, and have the best and brightest working on stuff. Because, when your family member has cancer, you don't want the C student working on your family member's cancer, and you don't want the C student not having enough time and energy to take care of it. And that's where we're at now. We're at now. You might have the A student, but the A student's overwhelmed, so it doesn't matter. And obviously, compassion and intelligence are important. You need both. But if you're treating complex diseases, you need really bright people, and you need a deep enough bench that they're not exhausted.
And as we get close to the end of the podcast, I just want to take a step back and ask you if you could give your 25-year-old self one piece of advice, what would it be?
Oh my God, that's a great question. It's a great question. That's a great question. I'm not one that looks back and says, oh my God, I should have done this, I should have done this, I should have done that. The advice that we give our children is we want you to be constructive adults and physically and mentally healthy, And so I don't know that that's the advice I give the kids, our adult children now. Would I give myself, I don't know. I think like I've gotten, as you get older, you spend more time having to deal just to make sure you stay physically and mentally sharp and healthy and all those things. But I don't know that I have any particular piece of advice. I think like, you know, people always talk about find your passion. I'm a huge fan of find your passion and make a living and support your family. Do both. Like I don't think you could. Most things aren't totally binary. You have to do both. So when people say like you get really rich, people say, like, well, find your passion. And that guy's passion was not building oil rigs. It was sort of like he made a great living doing it and took care of his family. I don't know. I don't know if I've got great advice on it. What we tell our kids is constructive adults and physically and mentally healthy.
That's great advice. And Scott, it was a pleasure meeting you and talking to you for this past hour. I'm really grateful that you were able to find the time to do this with me. And thank you so much for coming on the Strive podcast.
We are honored to be on. Thank you so much for having me and look forward to listening to it. And hopefully I didn't embarrass myself too much. Thank you.